we can see that it was a 40 decibel, then in 3000 it's almost 45 and 35, and then on 4000 it was 35. It's 30. So it was like 35, 35 and 30. Now if we consider that this is not a second year, but it's after few years, and the person is now able to hear from more than 60 decibels. If the sound is less than 60 decibels, he is not able to hear that. So the difference is 60 minus 30 is more than 10. So that means that the person is having hearing loss, which means like OSHA standard threshold shift. So for this, if generally it depends on the company's procedure, but when our clients are working and we are proposing, because as an industrial hygienist and as a consultant at the CIH, whenever we are conducting those industrial hygiene monitoring, we are enforcing them and suggesting them to fill one form where we can notify the employee, because everyone, if we have 10 persons are employee are there working in some area, we are collecting 3 to 4 samples, right, for a different person. So we used to send those notification letters that what was the results, what was your exposure in your area, and what is your condition, right? So we should notify the employee within 21 days. Revising hearing protection requirement. Are you aware of NRR calculation, noise reduction rating calculation? Who is knowing that? Only one. NRR calculation, okay, thanks. Okay, no problem. There is one slide where I have also covered this. So we have to revise hearing protection requirement. Although 50% when I am watching that and observing those people who are selling those earmuff or earplug, so if they are not knowing that the basic fund of calculation, they will sell and they will sell the product like this is better than previous one, you can buy this. But there is one calculation which we are calling as a noise reduction rating against the personal exposure. You will see that after few slides. And then for further medical evaluation, that the ball will be on the doctor's call now. So we have to prevent, as an industrial hygiene, as a safety professional, as a EHS person, we can prevent it further from the further damage. But now medical evaluation is required so that we can stop the exposure once again. So impact of the noise and auditory, non-auditory effects of the noise. So interference with the communication cause fatigue, distracting or irritating will be there, irritation will be there, reducing moral or efficiency of the employee. Just like right now I'm speaking well, it's okay, it's going well. Some noise every time when I'm sitting here since morning, and we can see that some siren is coming almost on every speaker time. I hope that it will be not be sound or noise for me. Then if we are talking about non-auditory effects of a noise, so it will also affect nervous system and cardiovascular system in case of high noise. It will interfere with the speech and concentration, which leads to unsafe act also, right? Agree or not? Agree or not? If high noise exposure will be there, right, and it will interfere with the speech and concentration of the employee, which may lead to the unsafe act by the employee because concentration is not that much on good side. And cause annoyance, stress, fatigue, reduce work efficiency, and it will of course lower the morale. So the terminology, the first one is the A, just like we have seen that whenever we are talking about the threshold limit value of noise, it's 85 decibel, we are writing as a dBA, right? So that's A means the A weighing, means the scale that adjusts the sound measurement to reflect human hearing sensitivity. Where C weighing is also available. The C scale is the frequency weighing system used in the sound measurement to mimic human sensitivity to the high intensity sound. It is less common used than A weighing, which focus on a lower sound levels. Generally, when we want to do the sound mapping, right, where the high impulse noise is there, that time we are checking the DPC, or else we can go for dBA. And the exchange rate, the number of decibel increase that leads to halving, the half of the allowing exposure time. Means, I will jump to this slide first. So means if as a ECGIH we have a threshold limit value of 85 decibel and exchange rate of a 3 decibel. So which means that if a person is getting exposure of 85 decibel, that means he is getting 100% of the dose of the noise. If he is getting 85 plus 3, that means 88 decibel of noise, that means he is getting double, 200% of the dose, which means that he should work in those environment for 4 hours safely. He can work in those environment for in that area without any protection also for 4 hours, right? Just like that, OSHA has a different threshold limit value and the exchange rate 90 and 5 decibel, and the factory Z, just like we all know that previously it was 90, but now we are following that 85 and the 5, with a 5 decibel exchange rate. So for the OSHA and the Factories Act, if we are talking about the Factories Act, so if person is working and having exposure for 90 decibel, which means that he is getting double exposure. So in those, in this exchange rate we are using as an administrative control, because when engineering control or other factors are not possible and we have those calculations, so by that we can considering that this person can work in 4 hours in this area, and we will replace it with another person from the area where exposure is not that much on higher side. By that we can reduce the exposure of the employee without spending much more money. Of course that manpower money will be involved. Then types of noise exposure. So continuous noise will be there, like constantly we are getting some noise from the fan, small fan, right? Or in industries we are getting noise from the motors, rotors, in compressors, right? AC ducts, sometimes AC ducts are there because of the vibration. Then intermediate noise, just like a grinding machine. Grinding machine will be not, we are not running for the full time. We will perform the grinding, then we will stop, then once again we will do the grinding. So intermediate timing will be there and we are getting the noise from that. And the third one will be the impulse or the impact noise, just like a gunshot, fireworks, hammering. So those are getting on a higher pitch volume, so that will call as a impulse or impact noise. So how do you know that you are exposed to damaging to noise? Just feel the need of sound, just like we discussed earlier also, that in order to be hear someone 3 feet away, because of sound level probably approaching more than or 85. If immediately after a period of high noise exposure, you are feeling some ringing or buzzing in the ear or whistling also, specifically after few years of getting exposure, these symptoms may be there. And equipment is tagged or marked as a noise hazardous. In many industries nowadays, we all are having those areas and we have marked logo that this is a high noise area. In some of the company I have seen that they have marked with the noise area also that this is a high noise area, and the last area monitoring result was this, so that people can understand that how high noise area is this. Specifically, if we are talking about noise induced hearing loss, I have not added one point, but I would like to add that about the autotoxic chemicals, where we are knowing about different toxicity of the chemicals, where we have a few of the chemicals which are autotoxicant, which means they will impact on the ear after getting exposure by inhalation, right? So autotoxicant chemicals are there, then we have to be very much careful, specifically to prevent noise-induced hearing loss. During handling of the autotoxic chemicals, you have to wear mask. Strange but true, to save the ear during handling of the autotoxic chemical, you have to wear mask also, or exposure should be less than that, right? Then this is the general estimation. Few of that I have mentioned that from the NIOSH website we got this photograph where the different just like a ringing telephone will be 80 decibel. Just like whenever I am speaking from my hand, if I am measuring that, it will be 80 decibel in my classroom. then it will be belt sander will be 93, then hand drill will be 98, tractor will be 96, chainsaw is there, bulldozer is there, ambulance siren is 120. From the siren, I just remember that in many industries we all are having forklift, correct or not? To avoid any accident, we are keeping reverse siren of a forklift. Agree? In few of the cases where I kept the monitoring of a vibration for the forklift along with the noise dosimetry, we found that the siren, because of the reverse mode of the forklift, exposure was just above the 85 decibel. Right? So make sure that whenever you are keeping or you are fixing the noise frequency or the sound level of the forklift siren, any siren, even though EOT crane siren is also there, in some cases it will impact more, right? Because all machineries are there, and along with that it will add that. So be careful with those factors, because it looks in very small thing that it's a siren for the safety, but somehow it will also impact to the employee's ear of specifically for the forklift operator. So let's start with the main part, that hearing conservation program. So in the first one, if we have to conduct the noise exposure or noise evaluation with the help of sound level meter. So if exposure is not more than 85 decibel, and specifically for the personal exposure it is not more than 85 decibel, it will be easy to solve the problem, right? Because there is no need of any implementation of the hearing conservation program. But if some exposure is there which is more than 85, try to implement on the engineering control so that we can reduce the effect, we can reduce the noise, and after any implementation we are suggesting that we should go for another exposure assessment so that we can evaluate it and we can judge that okay, exposure was less. But if still we are getting more exposure, then once again to eliminate the risk, it is required to implement the administrative control. Then once again evaluation is required, just like we discussed about the elimination administrative control by changing or replacement of substitution of the another person for half time or job rotation. But after that also, if noise is not less than 85 decibel, then it is required to implement the hearing conservation program. By that we need to go for the audiometric test, annual audiometric test, and specifically we have to initiate the training program for the employees as well. Why training is required? People are knowing now that exposure is there. Training is required or not? Who are with me that training is required in this case? That's good. Training is required specifically because everyone is knowing that how to wear earplug. Right? Everyone is knowing that how to wear earplug. Now after providing training, what do you think? For how many days they will follow that strategy? That we have to just squeeze it properly, then pull the ear and then insert and keep it like this so that it can be in a normal mode, right? So that we can get a proper protection. Practically, if as a safety professional, if you are a safety professional, then as we are all are aware that if we can see earplug from the in front of the employee, that means he has not worn that earplug properly. If earplug has been wear properly, then we cannot see earplug if we are standing in front of the employee, right? But we are Indians, just like we are keeping. I am from Gujarat, from Ahmedabad. Okay, so in Ahmedabad it's like that culture. Sorry to say, but it's true that all people are keeping helmets on the mirror, and we all are aware that where the cameras are and where the safety people, means police, are there. That time they will wear the helmet, and then once again they will put it on the mirror, because to prove that okay, I have wear the helmet in front of the police. Just like that, in industries also we can see that. I think safety officer have already seen those factors, that when we are walking towards their area, those people will be running all and they are there to collect the PPEs. I was in L&T, my first job was in L&T, MFF, I can see that if we have a red helmet and when we are going in this area, we can see that people are running over here and there to collect their PPEs because they have very much strict rules that only we don't have to say anything, just collect their gate pass. So it's a normal thing, but that's why training is required so that management is spending much more time and money on the purchase of the PPEs, right? Specifically on the training as well. But still, if they are not wearing it properly, our purpose will be not fulfilled. And still they will get noise-induced hearing loss. So that's why training is required, and specifically they should know that what is the impact on that high noise exposure. So after that, of course, it's still under control, then it's yes, then it's okay. But if not, then determine appropriate hearing protection, just like we talk about the NRR calculation. In the next few slides, once again it will be there. And then issue hearing protection as per the calculation, and then continue monitoring, and the program evaluation or review will be there. So key program elements will be noise exposure monitoring, then engineering and administrative control, audiometric evaluation, use of hearing protection device, training, record keeping, and program evaluation. So what will be the responsibility during this program implementation? So understand the need of hearing protection device. One more sentence I still remember from many industries, where as a safety professional or as a OSC or as a EHS professional, we are hearing from the workers or the employees, यहाँ तो मैं इतने 5 साल से 10 साल से काम कर रहा हूँ. I am working here since last 10 years. कुछ नहीं होता है. It's regarding unsafe act, unsafe condition, or a disease, or occupational disease, or exposure. कुछ नहीं होता. मैं 10 साल से काम कर रहा हूँ. काम अभी भी अच्छे ही है. Audiometric test करवा रहा हूँ मैं. But they are not aware that it will be prolonged period of time of exposure, right? And it's a chronic effect. All the industrial hygiene effect is a chronic effect. They will not get it very easily and very early stage. It will be maybe after their retirement also. So that's why we need to provide the training so that they can understand why we require the hearing protection device. Wear hearing protection device and seek replacement. One more point, as I have seen that we are providing disposable type of hearing protection device to the employee. But many times we can see that people are reusing it, right? And maybe storage is also not that much on good side. And because of that, it will be contaminated from the outside, right? And because of that, when they are using those earplug, they are getting foreign particles inside that eardrum. And it will also increase the chances of getting some disease or maybe noise-induced hearing loss as well, because it will also damage eardrum. Then encourage to the co-worker to wear the HPD hearing protection devices and communicate problem to the supervisors. In many industries, people are not, they are aware, in few cases they are aware, but they are not providing those information to the supervisor in thinking of that maybe I will lose the job. So that's why management responsibility is there, right? So that they can provide the occupational noise training, provide hearing protection device, demonstrate commitment. Just like I said, if management commitment is there, right, then they can believe that yes, management is with us and we want to reduce the noise-induced hearing loss. Enforce the use of HPDs. Keep up to the date with the HPD selection and use after conducting personal noise exposure. And encourage questions and resolve the problems. Why it is required? Because many times when I am performing some assessment, like qualitative exposure assessment or quantitative exposure assessment, people are saying that, sir, this is not fit to me. This is irritating. Again, not for the noise also, especially for the mask also, that sweating is there, we are not getting breathe, we cannot breathe properly. So many things are there. So for the selection purpose, of course, we should encourage them right? And in many few companies where we have developed the IH program, where we have asked, I think you are aware of respiratory fit test, right? So in those cases, we are asking them to come with the vendors, to come with the different types of hearing protection device or a mask, so that they can choose. Because of course, in a respiratory protection fit test, the same mask will be not perfectly fit to everyone, right? Just like that, hearing protection monitoring is also there, where we can check that how person is safe enough by this wearing those PHPD or not. So the first point, monitoring part. So of course that employers should monitor the noise exposure level to identify employees who are exposed to the noise level or above 85 decibel average over 8 hours of period of time. Specifically, we can judge those areas by conducting area noise exposure with the help of sound level meter. And specifically, first of all, I would like to thank Technovision company who gave me this photograph of the Casella noise dosimeter and the sound level meter, which is all good. As we are, as a consultant, as a CH, we are also using this Casella make. So sound level meter, basic instrument to measure the sound pressure variation in the air. I guess all of the industries, 90% of the industries are having some sound level meter, so that they can justify the environmental factors to check that what is the environmental noise exposure. And of course, this noise dosimeter is there. When we are talking about any exposure data, it should be a personal exposure data, because by conducting area sampling, whether it is air or it is noise, we cannot justify the monitoring with the conducting area samples to the employee's threshold limit value, because maybe employee will be not staying in that area for a more period of time. So specifically, noise dosimeter is required to conduct personal exposure assessment and to check the noise exposure results with the threshold limit value.